there is such a thing as stem cells, right? So if we're having scientific discussion and talk about the body, there is such a thing as stem cells and what do stem cells do. We'll talk about that a little bit today as well. So a little bit about me. I'm an independent physician assistant. I was actually the first independent physician assistant here in Utah. Historically, PAs have kind of worked underneath doctors. Nurse practitioners had a little bit more leeway because they were governed by the nursing board, so they were a little bit more independent than we were. But thanks to COVID and the lack of providers, a lot of states have made PAs independent as long as we have experience and are experts in our fields and that kind of thing. So I'm an independent physician assistant. My specialty is in orthopedics, essentially, and non-surgical orthopedics. I'm also an expert and instructor in ultrasound guided injections. I've been doing, I grew up in Southern California, undergrad at BYU, medical training at EVMS on the other side of the country. That was great. About 10 years experience in orthopedic surgery. I did about 6 years of orthopedic surgery in Washington State, and then about another 3.5 years here in Utah with some of the docs here. That's when I started using stem cells. It was actually when I was doing orthopedic surgery here in Utah because we were treating and doing surgery on a lot of our D1 or professional athletes, and we were trying to get them back to sports as soon as we could because these guys, they got to play. That's what they do. And so we would do ACL reconstructions, we would do Achilles tendon repairs, and then we put stem cells after the surgery into the areas. And what we saw was a 50% reduction in recovery time, and they were able to get back to sports pretty much months before normal, with normal recovery kind of thing. And so when we started doing that, we also started saying, well, we have some patients that are not really, some of the older patients who have osteoarthritis and they're not really good surgical candidates. What if we put stem cells in their joints and see what happened? And of course it worked. It looked great. They had less pain, more function, and we're happier. And that's what we like. We like patients to be happy and functional. So then I started saying, well, why don't we do surgery on this stuff if we can actually put stem cells in and make it better? What if we did it before surgery? Of course, that doesn't work too well for surgery because that's how they make money. So I got out of surgery and actually started doing alternative medicine, regenerative medicine full time about 8 years ago. And so I worked with a couple companies here in Utah. I'm also a part owner and provider for Stem Cell Institute of Hawaii in Hawaii as well. And we have patients that go back and forth to mainland Hawaii. And I've seen nothing but great stuff. And of course, things have had to change over time. The stem cells is still not experimental at this point. We know it works and we know what the stem cells do, but it's finding the right protocol to get the best and optimal healing for the area because everybody's different. If everybody was the same, you'd have just, boom, do this, and you'd be great. But everybody's joints are different. Some people have really severe osteoarthritis with meniscal tearing or soft tissue damage. Other people have very mild damage that maybe don't need quite as aggressive of a treatment protocol. So that's where the changes come into play. And that's where experience kind of tells us, and the studies that are happening with stem cells. We've been doing studies on stem cells for decades. That's where
yucky. Yeah. Oh, yum.
Makes people happy. That's what I like to focus on here. I've done various trainings all over the country on regen. I've trained people all over the country on regenerative medicine, stem cells, also on ultrasound guided injections, which I think is not absolutely necessary, but definitely helpful. And the patients agree they like it when they kind of see where the needle's going, especially when you're going into sensitive areas like the back or the neck, things like that. So I specialize in non-surgical orthopedics, ultrasound guided injections, married, 4 kids, enjoy camping, hiking, movies, and video games. But this is one of my favorite beaches on the Big Island, Kona side. Really fun place. But interesting story about me is that I actually was not able to do a lot of hiking, running, that kind of thing, because I had bad meniscus tear. During college, I was in college, it really bad meniscus tear on the right knee on the outside lateral aspect. And it was protruding and everything. So I had a knee scope done. They went in and they took probably about 3/4 of my meniscus out on the lateral side. And ever since I had that surgery done, which was probably my junior year of BYU, I had a really hard time running, jogging, just any kind of impact activity really started to hurt the outside of my knee. And so when I started to get more into stem cells in around 2018, I actually put stem cells in my knee. And went through kind of the whole program. I put stem cells in there, I put my PRP in there, I put ozone in there, and I put ozone in there a couple times. And then just kind of rehabbed it, and it actually got back. It's much better now. I mean, this is what, like 8 years later? Well, not that much, not that far, but 6 years later, I can run. Not very good at it, but I can run, I can hike. I'll actually show a picture of me and my son. We hiked Kings Peak, which is the highest peak in Utah. Did that a couple of years ago. Would have probably not have been able to do that with stem cells. And so I've had stem cells IV as well. Got it right when COVID came out. And I think it's one of the main reasons why I didn't get COVID for at least about a year and a half, even though I was treating COVID positive patients at the time. Now, eventually I did get COVID, but nothing's perfect. But yeah, my knee has been great, and even to this day, it's still way better than it was prior to stem cells. So the stem cells do work, and they can help create a little bit of new tissue in there. They can decrease inflammation and help to repair and heal damaged tissue. So we'll talk a little bit about that as well. So this is kind of our goal, right? Keep you out of this place. You guys know what this place is. I've been in surgery. I've been in thousands and thousands of surgeries. I've done total hips, total knees, ACL reconstructions, total shoulder replacements, back surgeries, all of these things. I am definitely afraid of going to that place as a patient. And my wife can testify to that. Because anytime I have to have some kind of procedure, I'm like, is there anything else we could do? Maybe that I don't have to go there, just because I know what can happen. And it's not that surgeries are bad. I don't want people to misunderstand me. I think surgeries are great and they're life-saving, and sometimes they're absolutely necessary. I agree with that, but sometimes they're not necessary. And I think we as professionals and medical providers have to be able to discern which ones need surgery and which ones don't, and maybe which ones we can try with things. But yeah, my goal is to try to keep patients out of the surgical suite if I can. And so these are some x-rays of some pretty bad arthritis. This actually Jim's patient we just treated, his hip looks worse than this. But this is bone on bone here with subpelvic cyst formation. You can see up here at the top, there's no space there at all. That's all that white stuff. This is a shoulder, bone on bone, bone spurs down here at the bottom. Rotator cuff probably compromised in that, but that's pretty bad arthritis. And these are some things that we can help. I do not move. Oh. It's just being slow. Maybe. That was just a glitch. Hopefully, if I try to get that. Yeah. Again, some other x-rays, neck, low back, ankle. You can see that the neck is supposed to be kind of a C shape when we look at a neck x-ray. It's called lordosis. We're supposed to have kind of a C shape here. We can see complete straightening and actually a loss of lordosis, even in a little bit of what's called kyphosis, which is the other way, a backward C. So this is significant damage to the neck with loss of alignment and spasm. Here we can see actually shifting of the disc. There's a little bit of arthritis here at L5S1, and then at L4-5 there, the discs are actually shifted off. It's called spondylolisthesis. All these nice medical terms. Make sure you remember them. There's a test. Just kidding. And then ankle arthritis. Can't see this one as good, but there's some arthritis between the tibia-talar joint. There, loss of space, kind of thing. So again, some things. Autoimmune diseases. Just some examples of autoimmune disease, rheumatoid arthritis. Anybody seen somebody with rheumatoid arthritis affects the hands? Pretty bad. Rheumatoid arthritis also, just rheumatoid in itself can affect the entire body. MS, thyroid problems. I mean, everybody, almost everybody has thyroid dysfunction. Gut issues, diabetes. Diabetes is rampant. I mean, these are some things that stem cells can help with. Of course, we have to also talk about lifestyle modifications, diet and exercise, that kind of thing. But what we found in the studies and through experience is that stem cells can actually help these areas repair and heal. Now, it's not a cure, but it helps. Neuropathy. Neuropathy is a big one. Anybody have neuropathy? Yeah. Or somebody has neuropathy, or my dad has neuropathy, or whatever. Huge. Number one cause of neuropathy usually is diabetic neuropathy, right? And that's because diabetes is a vascular disease. And you get constriction of the blood vessels, you get less blood flow, which means less oxygen, especially to the periphery. Less oxygen means those nerves start dying, right? At the feet, at the hands, that kind of thing.
Hey, buddy.
So how can you make that better? Well, you have to treat the underlying cause, which is usually get your diabetes under control, get your A1C down, change your life, change your eating habits, change your lifestyle, take your medications. But also to treat the nerves specifically, you need to get more blood flow to those nerves, which means more oxygen to those nerves. And you have to introduce something that can help the nerves heal. Nerves will heal over time. It's just if there's constant lack of oxygen and inflammation, they don't get a chance to. So that's why neuropathy tends to get worse. But if we can stop that inflammation cycle, inject some stem cells, some ozone, some PRP, get some oxygen to those areas. That's why hyperbaric chambers are great. Electrical stimulation is great. Vibration is great. Heat, ice therapy, and then stem cells. You can actually get the nerves to heal. And the numbness will actually resolve. So that's a huge one. Tendon and soft tissue injuries. Great place, especially for PRP. Now, PRP has been around for decades. PRP is platelet-rich plasma. It's taken from your own blood. We get a couple of those procedures today. We take the blood, we spin it down, and get the platelet-rich portion of the plasma. There's also the platelet-poor portion of the plasma, and that's good stuff too. So I like to use it all. And you can inject that into areas like tennis elbow, or Achilles tendon or rotator cuff. And it will help the healing process. You actually will heal it better if there's small tears. You get an even better result if you inject stem cells in those areas, because the stem cells, the PRP does not have the stem cells in it. It doesn't have the ability to regenerate and create new tissue, but the stem cells do. And that's why stem cells are key to actually regenerating some of these areas. And we'll talk about that a little bit more too, but these are some things that stem cells can help with. That may or may not need surgeries. The jury's still out on whether or not Achilles tendon tears need surgery. And so some of the studies say, no, they don't need surgery, just put them in a boot, they'll heal. And the other studies say, no, put them in surgery, and that's the best way, that's how they're going to heal. It's kind of either way. And so what if you just added stem cells to that area and put them in a boot? Will they heal better? Probably. I think they're still doing some studies on those. Memory issues, brain fog, Alzheimer's, headaches. Anybody forgotten why they're here? That kind of thing. These are things that are real things that happen to all of us at some point, usually. Maybe not Alzheimer's as much, but we get brain fog, we get memory issues. Alzheimer's is a big problem. They've been looking for a cure for Alzheimer's for years. Not saying that stem cells are a cure, but I have seen Alzheimer's patients do better on a stem cell regimen where we actually put stem cells IV. You can actually put it intranasal as well, back into the sphenopalatine fossa, just let it absorb into the brain. We've had some pretty good results doing that one. And so again, is it a cure? No. But can help? Yeah, because we know what the stem cells do. I'll talk about that here in a second. So why do these things happen? Why don't we heal like we used to? Why is it that little babies can fall off the couch and toddlers can tumble down the stairs and they get up and go, I'm fine, but if we do that, it's like, call the ambulance. We got to go to the hospital because as we age, we can make less and less. And stem cells is what creates,
Paying attention. Trying to get space, right? Okay. So basically, when okay, guys, no talk.
Stem cells continue to die off, and we make less and less stem cells as we age. In 2017, study showed roughly 50,000 people died daily of age-related causes. Nobody really dies of old age. They die of something that they were more susceptible to because they were older, right? But our body breaks down as we get older, so we're more susceptible to these things that cause that. And so if we can keep the stem cells going or inject a new life into the body of stem cells, we can actually, I wouldn't say prevent death, but we can definitely delay some bad things can happen, right? We lose about 3 million cells per minute. So we're constantly in a cycle of death and life in the body. Our cells of our skin are constantly stepping off, and then we're creating new cells. How do we do that with stem cells, right? Stem cells that we make in our body. The difference is that when we're young, like a newborn stem cell doubles every 24 hours, and after 30 days, you have about 1 billion cells. One stem cell from a 35-year-old doubles about every 48 hours, twice as much, and after 30 days, you have about 32,000 cells. That's a big difference, right? That's why babies grow and heal so quick. 65-year-old cell doubles about every 60 hours. After 30 days, you have about 200 cells, right? And that's why as we get older, we feel like we used to. Our body takes time. You get a little cut, and all of a sudden it's a big deal, right? It's not going to heal. It's going to take so what if we could change that? What if we could put stem cells in those areas that get damaged? Would they heal better? Of course they would. So we make different types. Sorry, this is why I shouldn't change the color on this. We make different types of stem cells. So the ones that they were trying to kill, those are embryonic stem cells. There's from an embryo that are going to divide, and actually try to make something like baby or an organ or or something like that. These are not allowed by the FDA. They're only allowed in research circumstances, and even then they have pretty strict access to and pretty strict on those. And so we don't mess around with embryonic stem cells. We also have somatic or adult stem cells, and these are stem cells that we make in the body, right? And we make them from the time that we're born until the time we die. These are undifferentiated cells found living within specific differentiated tissues in our bodies that can renew themselves and regenerate new cells. We can replenish the dead and damaged tissue. These are in most tissues of the human body, and they're replaced through normal repair, disease, injury. ASCs, adult stem cells, right, are found throughout one's lifetime in tissues such as umbilical cord, placenta, bone
You guys are
marrow,
doing
muscle,
5
brain.
minutes. Okay, just grab a ball and play. Remember to pick up the penny.
And there are places that you can actually harvest something in your own body to try to inject in the other parts of the body. Now, it's not a procedure that I usually recommend, unless you're young and healthy. A young, healthy athlete might be a good option. They're making quite a bit of young, really potent stem cells. As we get older, as we know, we're not making as much stem cells, and they're not as potent as they used to be. So it doesn't really make sense for me to take my adipose tissue or my bone marrow and inject it back into myself, even though it's mine. I don't think my stem cells are not as good now as they were 20 years ago, and they'll be even worse 20 years now.
Place to do that.
Why?
Yeah, I just would like you to answer that, because that's where a lot of places promote that, where you take that in your own bone marrow,
Right. And there's a few reasons behind that. There's some good studies to show that taking it from yourself and putting it back in yourself, which is called autograft, from yourself to yourself. There's no rejection, and you don't have to worry really about any kind of bad side effect or anything like that. Another reason why some clinics will do that is because it's another procedure they can bill for, and they don't have to outsource anything. They don't have to buy a product from somebody else.
There your toes, Rocky.
They take it from when they put it in you, so now they can bill you again for that, for that office visit kind of thing. And I know that's kind of bad to say that, but even in medicine, there's still a money aspect. It's still kind of a money game. And so some people think it's easier.
Hey, right around. Good job. I'm glad they made it.
That was interesting.
I think it's the
It's good.
We came from baseball.
Yeah.
Lindsay grabbed Dax and Kale from baseball.
That's awesome.
Me at Carter's game.
Uh-huh.
Lindsay called me because we got in a car accident.
Are you serious?
She's like, you need to meet me at the senior center in 13th and 90th. And I was like, is everyone okay? She's like, everyone's fine. So I drove from Alta Canyon, where Carter had baseball, to there. It's here. Yeah, she got clipped.
So it's not on her.
No, she got clipped.
You made it.
Completely safe, and they're effective.
Are you guys okay?
We know the quantity, we know the quality.
Sorry, we had a climb, so next they're safe.
Whereas you don't know some of that stuff when you take it from your own body.
Okay, pay attention, guys.
Does that answer the question?
I did.
Okay, very good.
Okay. You know.
Yes.
All right.
Well,
let's
I'm
see.
glad everyone is safe.
Again,
Okay,
talking a little bit more about the different types of stem cells that we make. There's hematopoietic stem cells, which are mainly kind of the blood stem cells. You just need those that kind of stay,
I'm gonna
they
point
turn
out what they
into
need to do.
more blood, like red blood cells.
Okay.
Uh,
Come here, guys. Come here.
and
Let's-
mesenchymal stem cells, which are the tissue
Wait,
related
not
stem cells. These are the ones that we like to use for
Okay.
healing,
All
especially in different areas of the body.
right. Well, these guys are the ones. Come here, ready?
There's
Oh,
neural
this is
stem
big. You know how
cells,
to do
which is
this.
the brain, epithelial
So,
stem
no.
cells, which are
Watch.
organ lines,
You guys
stem
oughta know.
cells,
Cal, pay attention.
and that kind of thing. A little bit of overlap there, but essentially you can see on here that a stem cell has the ability to reproduce and become different types of cells, and that's what we're looking for. And so 4 vital functions of the stem cell. They differentiate,
Follow this.
they can replicate, right? So you need one becomes 2, 2 becomes 4.
Yeah.
Now, what happens if you have cells that 1 becomes 2, 2 becomes 4, and it just goes out of control? What is that called? Cancer, right? So a lot of people say, well, can't stem cells lead to cancer? And if you
Take a look. Here.
stem cells, yes, because those
Listen to Coach. Listen to Nick.
form something like a
Listen.
baby
Listen. Kind of.
or organ or something like that. And those can kind of go out of
Yes.
control a little bit. What we found and what the studies have shown with mesenchymal stem cells, these don't mesenchymal stem cells, is that they're self-limited. And so they pretty much stay kind of where they're at, and they'll only kind of get the tissue they want. So they only kind of make tissue. And then they're self-limiting, so they only replicate active for about 9 months to a year. After that, they pretty
Leave
much
it out. Al, hop back in.
where they turn into where their exosomes are
Good job, Al.
that your body just uses.
Here you go.
Okay. So they're home to, this is kind of a cool thing too. There's been tons of studies that have shown stem cells
Yeah.
can release information in the body.
You got it.
And so if you have an
Okay.
area that's damaged, that's inflamed, the stem cells will actually home to that area and proceed to heal and repair and regenerate the damaged tissue. And there was a few studies where they actually did some, not marking, sorry, but marking of the cells. They infused stem cells into a person and they marked them with radioactive material. Not that type of radioactive, isotopes, yes. And then they took serial imaging to see where they went. And at first, of course, they were all over, right? You put them in the bloodstream, they go all over. And then you take another image a month later and you start to see, oh, they're kind of congregating over here and over here and over here. And then, a couple months later, you take another one and then boom, they're right there on the pancreas, or they're on the liver, or they're in the lungs. You're like, something's going on there. There might be something in the brain. It's kind of hard for the stem cells to get past the blood-brain barrier a little bit. That's why the intranasal technique, I think, is a little bit better for the brain sheet. But some of them can get through, and we'll see congregate in the brain a little bit there. So there's been some good studies on that, and of course, we know they repair damaged tissue. That's one of the main functions of stem cells.
What does that mean when it comes to it?
It means that they're homing into areas that are damaged that need to be repaired. Okay, and so because a lot of people thought, well, if you just put the stem cells in the body and they kind of circulate, they're just going to circulate, right? Circulate, circulate, circulate. They're never going to become anything or go anywhere, but that actually wasn't true. What the studies showed and what experience has shown is that they actually, when you put them in the body, they have migratory patterns and homing patterns where they actually will congregate and collect at areas of damage and inflammation in the body. And so again, another way that we can show that, yeah, I mean, these things are kind of pre-programmed to just seek out damaged tissue and areas that need to be healed and repaired and regenerated and do exactly that.
So that you can put stem cell anywhere, then your body will figure out where to go.
Essentially, yes. And so that's why I think it's a good treatment to do IV stem cells. It's a great treatment for systemic disease, autoimmune diseases, things like that, because they will target those specific areas of the body to try to heal and repair, regenerate damaged tissue. And again, not a specific cure for these things. The studies have not shown that, but they show that they do congregate to those areas where the damaged tissue is. So say like a diabetic, they'll kind of congregate around the pancreas, the kidneys, the liver, that kind of thing. And so with MS, we've seen it kind of congregate around the nerve areas of the body, maybe nerve areas, ganglia, and the spinal cord, and that kind of thing. And so again, they don't cure it, and it's not a cure, but they cover each of those areas, and we know what the stem cells do is they repair, they regenerate, they heal damaged tissue. So they're helping, right? And that's what we've seen. We've seen the stem cells help a lot of these things. And so again, just further affirmation that yeah, these stem cells actually are doing something in the body. They're not just floating around like snake oil, maybe doing something. No, we have scientific proof. Does that answer your question?
Yes.
Okay. Sorry, sometimes I get to ramble. Anyway, so a little bit more about stem cell function. Adult stem cells, mesenchymal stem cells, also called MSCs, were originally discovered in bone marrow because we knew that. We knew that stem cells come from bone marrow. They've all since been found in other places in the body, okay, like adipose tissue and certain areas of connective tissue. Bone, cartilage, fat, a lot of these can contain stem cells as well. It's again, what's the quantity and what's the quality of those stuff? Hard to know. Hard to know. Mesenchymal stem cells found throughout the body, including in the bone marrow, can be directed to become bone. So we know that. They can also be directed to become cartilage, fat, possibly even muscle. And there's good studies on those as well in the International Society of Stem Cell Research. So we know that these can be put in a certain area, or we have them in the body in a certain area, and they can be directed to become those types of tissues, right? So if I put stem cells in the knee, odds are they're going to stay in that knee and become that type of tissue that we need them to become. That's what we're getting at. So where else can we find stem cells? MSCs are found at lower density in blood, a little bit, not a lot. In peripheral adipose and other tissues, MSC-like cells can be isolated from the umbilical cord. Now this was cool because it's like, well, we know the umbilical cord is super important for the baby from the placenta, right? That's how the baby gets nourished, fed, and how it grows. But the question was there anything else in that umbilical cord that could be useful besides just the cord blood, right? Because we know cord blood is good, has all the richness and stuff to feed the babies. What they found was that the Wharton's jelly inside the umbilical cord is actually chock full of mesenchymal stem cells. And it's one of the ways that the baby gets the nutrients that they need to be able to grow as fast as they do. So could you take the Wharton's jelly from an umbilical cord, harvest the stem cells from it, and put it into an adult body? And would it work? And a lot of the studies have been focused on that. What they found is, yeah, we totally can. And that's what we've been doing kind of over the last basically 20 years, since they originally thought, can we use this type of tissue, the placenta, the umbilical cord, the Wharton's jelly, that kind of thing, to enhance healing in something that's broken, worn down, degenerated? And yeah, it works. It works great. So essentially we have kind of this magical stuff, right? From the placenta, from the umbilical cord, the Wharton's jelly, that also has the same exact functions of the mesenchymal stem cells, where they can become hematopoietic stem cells, mesenchymal stem cells. They can differentiate and take on a lineage into a new type of cell. And we know from the studies too that they can be directed. We put them in a body at a certain place, they can be directed to become those types of tissues. So then it makes sense that if we've got a worn out knee, where should we put the stem cells? In the knee. If we've got, back, low back, neck problems, where should we put the stem cells? Put them at the neck, put them in the low back. If it's an autoimmune disease or some kind of systemic problem, where should we put them? Put them in the blood and go through the whole body. They will seek out the areas they need to fix, and they will become that tissue. And so this is taken from the RRG website, which is the Regenerative Research Group. That's the lab that we use essentially to get stem cells from. Umbilical cord tissue, placental support matrix, regenerative cells from umbilical cord and placental tissue, taken from the birth waste. What usually happens to birth waste? Why do they call it waste? Because they burn it up. And in other countries, actually, I met this woman from Germany. Very, very common practice, at least she told me, was to keep the placenta. She freeze-dried it and ate it over the next 1 to 2 years. Kind of chopped it up, and it's all good stuff. And we're over here in the US just burning them and throwing them away. But could we take this kind of waste tissue and make something use out of it? Yeah. And that's what they do. And that's what they do at RRG as well. So a lot of questions are, well, is it from, abortions? No. Are there any damage to the fetuses? No, this is all post-delivery. But just the birth weight stuff. Is there any damage to the mom? No. No harm to the mom, no harm to the baby. RRG has a lab here in Utah. They're actually gonna start have 2 labs, and they have a lab in Florida as well. And the cool thing is that they were very prodigious, and they stockpiled a lot of birth tissue prior to COVID, which is, and it's all cryopreserved, cryopreserved. And so we can actually provide stem cells from the umbilical cord and placenta tissue that is pre-COVID. Because everybody's exposed to COVID at some point. But if we can give tissue that's been, or stem cells that have been not exposed to COVID, probably better. There still needs to be more studies done on that, whether COVID has a significant effect on stem cells available now versus before. Who knows? Tissue is decontaminated, sterilized, cellular harvesting process, and then cryopreserved. Usually shipped same day or overnight. Once they thaw, you got to use them. And so you can't rethaw them again. Again, this is RRG Regenerative Research Group. And this is again taken directly from their website. You guys can check it out. I have the website on here somewhere. Placenta-derived allogenic human cell and tissue products. Remember, I mentioned allogenic versus autogenic. Auto is human cell, allo. Ethically sourced placental tissue through extensive procurement network. Over 50 years combined experience span. I was using this product 8 years ago when it was under a different name. And it's even better now. Product's even better now. They're getting better and better. The labs are getting better and better at being able to process the tissue and harvest the stem cells with more live stem cells than ever, which is nice. Methods of administration. We can basically put them in. The stem cells are safe to use and safe to pretty much put anywhere. There has not been any documented rejection or reaction cases, probably in the last 20 years. If there's any kind of side effect, it's usually due to inflammation from the injection itself or from inflammation that's already in the body, where the injection caused just a painful inflammation response. Typically, though, there is no rejection or reaction. You can put them IV, they go through the whole body. I put them in the scalp, I put them in the face, I put them in the neck and the shoulders. Trying to think as I go here. Great question. The question was, how long does it take to actually see any benefit? Well, I'll give you an example. I saw 2 gentlemen today that I injected stem cells in them last week. Both of them are already feeling better as of 1 week. And now that's not all the time. That's not every case, but typically I hope to see some kind of benefit within the first month. Okay. Now stem cells are active and actively replicating and healing for about 9 months to a year. I'm interested in that timing, right? 9 months, 10 months for pregnancy. I don't know. Just kind of interesting the way that works out. But yeah, they're actively kind of replicating, repairing damage, healing, and becoming new tissue for about 9 months to a year. And so I think it's best to try to support those stem cells during that entire time that they're replicating and repairing and healing damage while we're trying to decrease inflammation as well. Because inflammation is the word. That's what causes the pain. That's what causes all the problems. And the stem cells will constantly fight against that inflammation and try to repair the damaged tissue. But if you have ongoing inflammation that overpowers what stem cells can do, you won't see any result. You won't feel better. So the key is, yeah. Oh, I thought you had a question. So the key is to try to decrease inflammation while we support the stem cells with a program like with ozone and PRP and things like that, red light and vibration, sound wave, so that the stem cells have the best chance to heal the damaged tissue without the inflammation getting.
You wouldn't just add more stem cells? You
can, but it comes to a point where adding more stem cells won't necessarily help. I've hit that point a couple times where really just the more and more stem cells we put, we really didn't see much of an improvement. And I think that's because of the self-limiting factor of the stem cells. But, and also the stem cells are not covered by insurance and they can get a little expensive as well. So if we can do it with what I think is the minimal optimal dose of stem cells and then support those stem cells to the optimum, then we can get a much better result than just trying to throw more stem cells out. Now, occasionally in the program, we do get to a point where somebody got sick or they got COVID or something, and now the body's trying to fight all that, and the stem cells kind of go on the back burner a little bit. It's like, well, we may need to do another dose to try to hit this. We can't really make everything better. Things are going to happen, and they do, and some people, especially my high-end athletes, they want to get out there and get playing again. As soon as they start feeling better, boom, they're gone. And I'm like, no, don't do that. We need to wait at least about another month before we do that, because then they end up causing inflammation and getting hurt. And then they come back and they go, yeah, I twisted my knee wrong, and now it's a lot more sore than it was before. I'm like, yeah, you just caused a whole bunch of inflammation in that knee that we were trying to get down and try and get to heal. So we're kind of taking a step back, and now we got to really shut it down, try to support it more with PRP and ozone, and then we'll see, maybe we need to put in another round of stem cells kind of thing to try to help. But great question. Does that kind of answer the question?
Yeah, then I have a follow-up question is, why isn't insurance covering it? Do you see that in the future? It will, because if it can alleviate the cost of surgery, can you go into that, or is that?
Well, I mean, there's many reasons for that, and that becomes kind of more logistics and kind of
Politics.
a lot of politics, a lot of politicking in the answer to that question.
No, the FDA, who runs the FDA? It's all the former pharmaceutical and these medical devices.
So, yeah, I don't want this to turn into a kind of an anti-pharmaceutical lecture, but there is a lot of politics surrounding that, along with the pharmaceutical companies, the insurance companies, and the medical. Yeah, exactly. So, do I see it in the future? Probably not.
But like Utah, with the SB 199, the new legislation in Utah, it now allows for patients and practitioners to do it. It's still self-pay.
Yeah.
And there are some products.
That's as of today.
There are some products that are reimbursed. But the human cell tissue products.
So as of today, they allow
It allows
other
it to
people
go.
other than doctors to do it.
So they allow us now to be able to get the word out to everybody a little bit better and more efficiently that this is available. And they're kind of opening the doors a little bit more to this type of treatment. However, it's not covered by insurance. Okay. And in a lot of views, it's still considered experimental.
Even though it's been out for 3 years.
Exactly. Yeah. 30 plus years. So yeah. Does that answer your question? Okay. Very good. I always want to make sure the questions get answered because somebody like off on tangents. Get distracted. But yeah, these are just some of the more common areas that I've treated over the last 8 years doing regenerative alternative medicine. Number one thing I treat usually is knees. Okay.
David in Tijuana now?
The knees. I can't tell you how many knees I've adjusted. Millions probably at this point. And I get people who are deathly afraid of surgery, of the total knee replacement. Now, the total knee replacement it's a good procedure, and they've gotten it better to where you don't even really have to stay in the hospital anymore. They can do it as a same-day procedure, and the technology and the robotic assisted surgeries have actually come a really long way. And it's a very good procedure, and I think it helps a lot of people. Does it have to be done on everybody? I don't think so. I don't think it has to be done on everybody. And I'll give you an example of this. This is one of my, probably in the first or second year I was doing orthopedic surgery in Washington State. I see this old guy come in and he's walking like this. Probably the worst kind of cowboy Barrett's knees I've ever seen. And he's walking along like this, and I said, "Oh, you're here for your knees?" And he goes, "No, I'm here for my shoulder. My knees are just fine. They don't hurt me at all." And I'm like, "Great, perfect." And so So I was like, well, I guess he doesn't need anything on his knees. And that's what it comes down to. Is that, yes, the x-ray might look awful, worst thing you've ever seen in the world. But the patient says, I can move it and it doesn't hurt me just fine. And yeah, I limp a little bit, but I can get around fine. Does that patient need surgery? No, that patient doesn't need surgery. That patient just can go live their life happily. Now, if they want it to get a little bit better, you could try something like stem cells, which is completely safe, non-surgical, and will make it better and probably give you a little bit more function, a little bit more motion, and less pain if you're having pain. But you don't need surgery. And so one of the reasons I got out of surgery too was the surgeons. I mean, surgeons are like a kid with a camera, right? Everything's a nail. And they see something on an x-ray, and this is a blanket statement, and I love surgeons. You guys are good. I'm not a surgeon hater. But how do surgeons make their money? Doing surgery. Yeah. So it makes sense that what they're going to usually recommend, and that's how they've been taught to in medical school and their fellowships, is that, yeah, they see an x-ray and they say, oh, yeah, you need a knee replacement. That's how we're going to get rid of that arthritis there. Sometimes without even asking the patient, does this actually hurt? Does this actually bother? Because I've spoken to some patients who were recommended a knee replacement, and I actually asked them, what's your pain level on a daily basis? 2. You get by pretty well. You're able to do most of what you want to do? Yeah. You take a Tylenol or ibuprofen every now and then. You feel fine? Oh, yeah. Well, why does the doc want to do a knee replacement on you? Because he says my knee is shot. And I'm like, I don't think you need a knee replacement. I think you're doing just fine on your own. And if you want to try something that's non-surgical and doesn't have all the risks, you can try some of this stuff. But there's been some people who I've just been like, I don't think you need a knee replacement at all. I don't even think you need anything. I think you're just fine. Keep going and do your thing. And when it gets to like maybe a 7 or 8 daily, that's when you probably need surgery. It's when the pain is so bad, I can't do what I want to do. I can't get around. I can't sleep. I can't, function anymore. That's usually when you need surgery.
And with your joint injections, you always recommend doing with ultrasound guidance. It seems like that'd be a better method.
Yeah, the question was, do I always recommend ultrasound guided injections when I do my injections? And the answer to that is, you don't necessarily always need to use an ultrasound machine, especially if you're proficient at injections. I mean, if you've been doing injections for 20, 30 years without an ultrasound machine, you're probably going to know what you're doing. And that was the same. I never used an ultrasound machine for my injections until 2018. But I started practicing 9 years before that, in 2009, doing injections every day, all day long. So I had never used an ultrasound. I had injected basically everywhere you can. And so sometimes I don't need the ultrasound, and the ultrasound just gets in the way, like when I'm trying to inject like fingers, things like that. There's just no room for the ultrasound at that point. But I think for certain injections, like deep hip injections, neck and back injections, even knees, I think the ultrasound is very helpful. And I do recommend it at that point. Plus, it's nice to be able to just kind of move it and show the patient, this is what I'm looking for here, and this is where the needle's going to go, and you can see this here. There's not a lot of cards here. What's going on? Because a lot of times they don't get those kind of things. I do recommend the ultrasound, and I think it helps improve the location and specificity of the injection. Is it absolutely necessary? Depends on your experience.
So I have a dentist who uses stem cell for his diabetic patients that have trouble growing bone back when they're doing implants, and implants aren't sticking. So what do you recommend he go about doing this? Where do you recommend he inject, like the mouth?
So the question was about dentists using stem cells with implants, correct? And I've spoken with quite a few dentists, and they like the idea. They like the idea of having the stem cells in there. And I actually recommend that they have it in the bone matrix when they're filling the defects before they do the implants, because that way the bone will grow in better and harder and more dense. Studies have shown that stem cells can actually help bone density. I've seen people go from osteoporotic to normal. So the osteoporosis, severe loss of bone, or severe bone density problems, to normal. in the hip, just from stem cells. That lady actually did end up having surgery because I treated her a couple times. She just didn't get, she kept having problems and the arthritis was just too bad. But the surgeon told her that her bone was so good at the time of surgery that there was absolutely no risk of fracture of her femur, which is crazy because she was osteoporosis before. And so a lot of times with those surgeries, you have to be very careful when you're cutting the femur that you don't crack the femur, because then they have to put cables. And she actually did really well. So yeah, back to your question. See, I get off on these tangents. Back to your question. I do think it's very helpful in dental surgery, especially with implants. I think it's best when added to the bone matrix that they're going to put in the defects to before they put the implants in to get more consolidated and dense bone.
And if they've already had them and they're failing, take them out and try again?
See, that's tough because studies haven't really been done on that to show whether that's helpful or not. We know that injecting the stem cells at areas of damage and at areas of bone loss will actually improve the bone density and heal the damage. So could you inject stem cells at the areas where the failure is happening and have a good result? Yeah, theoretically, yes, that's an option. Unfortunately, I just don't have the numbers for you or any study data and results to say whether or not that's helpful. Yeah, that's what I've talked to the dentists about and the orthodontic people, and that's what we've kind of agreed together that's kind of where they would like to use it as well, is in the bone matrix before they do implantation. But stem cells are funny things. You can inject them anywhere and they will help repair damage. So
somebody with the rheumatoid arthritis, the big knuckles, if you inject in the knuckles and it will reduce the swelling or the whatever.
Sure. Right. So the question was about rheumatoid arthritis in the hands, with the knuckles and the joints becoming big and swollen and arthritic. Would injecting those joints help to decrease the swelling and make them better? Yeah, the answer is yes. Unfortunately, it does not solve the problem of the rheumatism. Okay, so the rheumatism is still there. So you still have the autoimmune disease that's attacking the cartilage in your hands and fingers. So putting the stem cells in there, yes, does stop the inflammation cycle. It can decrease swelling. It can make them feel a little bit better, maybe even move a little bit better, but it's not going to heal or cure the actual disease process, and the deformation is still going to be. But it is helpful. I like, with my rheumatoid patients, I like to treat IV and locally. Sometimes it's not feasible to inject every single joint in the hand. It's painful, and sometimes the deformity is so bad that you can't really get the needles in where you need to go. So we focus on the ones that are the worst, and so sometimes I'll just say, yeah, I want you to inject this one and this one and this one and this one. And those ones do usually do better. The swelling goes down, then you're able to move them a little bit better, and there's less pain. Okay. All right. Any questions about that? So basically, you can put the stem cells anywhere. Another thing that's become pretty popular in the last decade, couple decades or so, are the Priapus shot and the O shot, the P and the O shot. And you can actually, those typically has been PRP, but you can use stem cells for that too. Stem cells have been shown to be helpful with erectile dysfunction, Peyronie's disease, and a couple of other genitalia problems. Prostate, yep, prostate for sure. And so some of those are direct injections, some of those are IV or directed IVs. It just depends. But yeah, very helpful. This is kind of a bigger list of things that I've seen, that I've treated with stem cells. COPD, oh my gosh, and end-stage lung disease. I had this guy in Hawaii. Unfortunately, he's passed away now. COVID really kind of did him in. But when I first saw him back in 2019, and I thought he was on his deathbed then. I mean, he came into the clinic, my clinic in Hawaii. He had cardiac oxygen. He was on his nasal cannula. He actually had a mask on doing. He's just, just huffing and puffing. He had end-stage COPD and lung disease. And I was like, man, this guy's gonna die right here on the table. like, it was kind of scary. So we treated him with IV stem cells. Okay, because we know the IV stem cells are going to go through the body because it's not feasible really to try to inject the lungs, nor do I recommend it. You're going to cause, a pneumothorax, or something like that. But so how do we get the stem cells to the heart, to the lungs? IV. IV is the best way. We know they'll home to those areas of inflammation and damage. And so we treated him. I put two units of stem cells in his IV and said, okay, we'll see you back in a month. He showed up the next month and he's still carrying his oxygen tank. And I'm still thinking, I don't know if this is going to work for this guy. We ended up treating him probably over the next 5 years. Every other month or so, we were giving him IV stem cells, and he was getting better. He showed up. He drove this El Camino. Oh, it was so nice. And you'd always know it's him. He's like, oh, there's his car. He'd show up. Pretty soon, he didn't have his rack of oxygen tank anymore. Then he wasn't even using his walker anymore. He's just showing up, and I'm like, hey, where's your oxygen? And he's like, I don't really need it right now. Even better. So he was actually doing really well. And I think the stem cells were basically reversing some of the damage in his lungs, and he was improving by leaps and bounds. Unfortunately, COVID shut down Hawaii completely. Nobody really in and out. And he ended up getting COVID a couple times. Got really, really bad pneumonia, died. But if it weren't for COVID, I think he'd still be with us. And I think it's because of the stem cells. So, thank COVID. Golfers, I've always taken iliac joints, SI joint problems, low back, neck and back are probably the second most common thing that I treat after knees. Then it's hips, and then shoulders, and then let's see, probably ankles, wrists after that. But all of these things can be helped with stem cells. Yeah.
Okay, the prior slide you had was, you said scalp.
This one.
Yeah. Is that for hair loss?
Yes, yeah, for hair loss. And so typically for hair loss, there are peptides, there are creams, there are some medications that can help with hair loss. Stem cells are actually a pretty good option for hair loss, especially if it's just an area of hair loss. You can actually put stem cells into that area, and stem cells will encourage new follicle growth of that area. And you can get your hair back, kind of thing. And so I've done PRP and stem cell treatments of entire scalps with really good results. Sometimes it doesn't quite work the way I hope. Again, it's not a cure, but you can get new hair to grow. Yeah.
Hair, human capital, hair. Those are really good, especially hair based stuff.
Yeah. Yeah. Exosomes are really, really great. But yeah, scalp, face, kind of like Botox injections. You can put stem cells in the face at the wrinkles. And instead of like Botox, where it just kind of paralyzes everything, you can actually get new cellular growth at the skin level, so the wrinkles actually go away, which is kind of cool. And you rejuvenate instead of paralyzing. Yeah, I'm not saying that Botox is bad. Botox is great, and it definitely has its place. But the stem cells are really actually a pretty good option for face rejuvenation.
I have a question about the spinal degenerative disease. What results have you seen from that?
So the spine's a tough one. A lot of bad things can happen with the spine. They fall under a category called spondylopathies. And you get disc disease, you can get osteoarthritis of the spine, you can get slippage of the discs. I mean, complete collapse. And a big problem is that on the sides, what comes out of the sides of those discs there is the nerves, right? The nerve roots for the rest of the body, especially with those spine, the nerve roots for the whole lower body there. And so it can cause a lot of problems. Typically, the treatment for backs and spines is not super awesome. Usually you can do epidurals, you try to do injections. These are things that are non-surgical. You can do chiropractor, physical therapy, massage, acupuncture, things like that. And they help some. Once you get surgery on your back, the odds of having more back problems or needing a repeat back surgery are pretty high. actually. And that's why you'll meet people say, I'm on my 7th back surgery. You know, it's just because usually they do a microdiscectomy and they can put a silicone disc or something, titanium disc in there. But inevitably, you're going to have problems above and below. So then they'll usually go in and do kind of a fusion or something like that. You're still going to get problems above and below. And you may have mechanical issues now with loosening of plates and screws and things like that. And so the back just still continues to degenerate over time. And so there's really not a great way to stop the back from degenerating when you get serious problems. Even the stem cells, again, they're a good option, but they're not a fix-all, complete, cure for it. The stem cells I have seen in cases where we've had disc protrusion or disc bulging, where the stem cells can actually help the disc rehydrate and fix some of that damaged tissue. Some of the ligamentum on the sides gets damaged when we get slippage of the disc or when we get scoliosis, and that causes a lot of pain and inflammation. The stem cells can actually help heal some of that pain and inflammation, so it doesn't hurt as much. As far as fixing the underlying degeneration, there's a little bit that stem cells can do there, but again, it's not a cure. And so the back will still continue to degenerate over time. It's just how can we delay that degeneration? I think the stem cells do a pretty good job. They also help with decreasing inflammation around the nerve roots, because if we get pain at the nerve roots, that's when we start getting neuropathy and we start getting sciatica and things like that. And so putting stem cells around the areas of damage will help to heal some of the damage, repair some of the damage, make new cells that can actually kind of keep the damage in check, and then heal some of the surrounding areas, such as the soft tissues and the nerves. So long story short, the stem cells, I think, are a good option for the back. They're safe. They're not going to damage anything. If you have a practitioner who's using ultrasound guidance and knows what they're doing, I think it's a great option, and it will help back pain. It will help back degeneration. It's not going to cure. Kind of thing. Does that kind of answer your question?
Yeah.
I think it's a very good option. I've treated, thousands, maybe millions of backs, and on average, I would say about 80 to 85% of people that I treat for backs, necks, or lumbar spines feel better. So, all right. So a few things that could, before we finish up here, stem cells can help many medical issues. A lot of things stem cells can help. There's sometimes where things stem cells can't help. And so, like, I had one guy come into me, this was actually pretty recent, and he had pretty bad arthritis of his knee to the point where he was pretty varus, right, bow-legged. And I said to him, how much does it hurt you? He said, it doesn't really bother me that much. So what are you looking for then? Well, I want my knee to be straight. Stem cells are not going to do that. Okay, they're not going to straighten the knee for a couple reasons. Number one, you lost a significant amount of cartilage in that knee that the stem cells just won't be able to regenerate that much. Number two, you had tightening of the ligaments on this side of the knee and stretching on this side. And the stem cells are not programmed to lengthen this one while tightening this one, and so my recommendation to him at that point was, if your main concern is your knee is bowed and you want it straight, surgery is the option, because they will straighten. So, so some things it's just not the best option for. These are FDA allowed products and monitored, and they have to be from an FDA approved lab, but they're not FDA approved like a drug. You see what I'm saying? And so the FDA approves drugs to be used as a treatment or cure for a specific disease process. That's not what stem cells are. Stem cells are FDA allowed, and they have to be from a FDA monitored lab that passes FDA inspection. But they're not a drug. And that kind of goes along with saying, again, they're not a specific cure for that kind of disease. There's no guarantees, even though the success rate is high, like with knees, with an osteoarthritic knee that's pretty straightforward. Usually the success rate is going to be about 90–95%. Okay, with stem cells. That's pretty good. And I've seen that time and time again, because we know what the stem cells do. We know they're going to decrease inflammation, they're going to help repair some of the damage, and they're going to build a little bit of new tissue in there, and the person's going to feel great. But there's still a 5% chance it may not work for you. Now with things like the back, it's kind of more like 15 and 20% chance that it may not hurt you because the backs are so complicated, so complex. But other things like tennis elbow, it's a 90% that it's going to help with tennis elbow. And that's just because, again, we know the process of what stem cells do, and this is a pretty straightforward process of what tennis elbow is. So when we start adding more variations and variables into the injury and the disease process, it gets a little bit murky on, I'm not sure I can tell you exactly the percentage or the success rate on this, but the stem cells are going to help. I just can't tell you how much, and there's a chance of it. Okay. Is it safe and holistic? I'm sorry, it is safe and holistic. Just trying to keep you off medications, out of surgery. It's great for pain. So many people are taking the narcotics, they're taking opioids, they're taking the Percocets and the Vicodins, right? And if we can get them even to lessen those, like they're taking them every day, now they're only taking them once every 2 days or something like that. That's great because that's going to start to get them away from the dependency of the narcotics. And so really, really good. And then we get to the point where they just use Tylenol or something like that. We use the team approach, usually recommend a program of various treatment modalities to ensure overall best healing. And I talked about this before. It's because and we're a couple clinics like this, if you just put the stem cells in and then, see you later, have a good life. What they found and what experience has shown, and even some studies have shown this too, is that you get about between 30 and 40% less success than if you support the stem cells with some kind of program with alternative and various modalities such as ice and heat. Mostly heat, because ice will constrict, and ice is fine for later on, but heat in the beginning. But if we can add in PRP to support the stem cells, ozone to support the stem cells, if we can add in red light and shock wave and vibration there and electric stimulation, all of these things help to stimulate healing and regrowth and repair and regeneration. PRP is platelet-rich plasma. Okay, the question was, what is PRP? And the platelet-rich plasma is found in your blood. And so these things are all very good. And so usually over the years, I've found that just treating and streeting, which is what it's kind of a terminology phrase, but you don't get as good result as if you see the patient kind of on a regular basis to support the cells and have a program that works along with dietary and lifestyle changes. Those have to be in there too. So that works better, I found over the years that I've. That's why I usually recommend a program. And that's why Pur Life here is great, because we have the red light bed and there's the cold plunge and the sauna and the vibration, the shock wave. We have everything here that we need. So we can give you the best, and it's all about getting the best outcome. Because I want them to work, you want them to work, everybody wants them to work, and so we're going to try everything we can to make them work, help them work. These are just a list of some other modalities that I just mentioned. Acupuncture, great. Acupuncture is great. It's been around for millions of years. It is awesome. I definitely recommend acupuncture. Stimulation, E-stim, TENS units, these are all good. That's why they use them in physical therapy, because they actually help the healing and regeneration aspect and recovery. Prolozone or ozone therapy, PRP, chiropractic, massage, physical therapy, diet and lifestyle coaching, functional medicine, red light, vibration, heat, IV therapies. All of these are great to add in to help. So time to start thinking beyond the pills and beyond the scalpel kind of thing. And that's what I've been focusing on here. So frequently asked questions. Is this covered by insurance? We already covered this. It is not. The only insurance I found to cover it was, I think the VA will cover it if they've tried everything else and a doctor recommends it. So thank you, VA. There are also some of the mutual insurances, the ones where people pay in and have covered some of it because they get allotted to certain things. But your mainstream insurance companies like United Healthcare, Blue Cross Blue Shield, Select Health will not cover. Okay.
Those HSA covered?
Typically not, but maybe now. Yes. Didn't used to be in the past, but I think now you can use HSA because I think you can pretty much use HSA for anything that's outside of anything that's out of pocket. Yeah,
Your funding is zero.
yeah,
So-
'cause- yeah, so anything that's out of pocket, you can typically use that for, so. Yeah. How much does it cost? That varies. That varies a lot. It depends on what disease process you have, what's going on, how many stem cells we need to use, what type of program we need to create for you. And so that just, that just varies. I can't even, it just depends. There are some clinics out there that will charge you an arm and a leg to get the stem cells, $20,000-$30,000. And you can go to Panama and get 1 billion cells for $20,000, but you got to get yourself to Panama. And
you don't know where they're from.
Yeah.
You tested them.
you don't know where they're from. And so, I've had people go down to Mexico and get stem cells, and I'm like, I always kind of cringe a little bit when I hear that, because I'm like, we don't know where they're from. They're not FDA regulated, and yeah, they might be cheaper, but you're really running a risk there. And so we try to keep the cost down here and make it affordable here in the States, especially here at Pure Life and RRG. We try to make it affordable. And so, but it just varies. But if you have questions about that, you can talk to the managers, Jordan and Jeff, and they can go over that with you in a consult. Is there any chance of reaction to tumors? Again, we talked about this too. No, because we're not using those type of stem cells. We're not using those embryonic type of stem cells. We're using mesenchymal adult stem cells that are really tissue oriented. So there's no tumors. They don't go out of control. They're self-limiting, and there's no reaction or rejection. They can be used in everybody. Like O-negative blood. How long does it last? Could last for years. Again, my knee is kind of an example of that. It's been now 6 years since I did that, and my knee's still going strong. I have patients that I treated back in 2015, 2018. They're still doing great. You know, occasionally do you need to re-up the stem cells or get another dose? Sure. But on average, it's years. You can add years to your joint, years to your life, years to your happiness.
Sounds like, sure.
Yeah, but we shy away from saying that word. She said it sounds like a cure, but we shy away from saying that word. It helps. Let me just say it helps. Is it effective and safe? Absolutely. Absolutely. And I've done them in myself. I've done them in family members. I've done them in coworkers. I've done them in my friends. No problems whatsoever. So the biggest question, will it help me? That should be your biggest question. Will it help me? And if you think it might, then I think it's worth coming and talking with one of us and having a consult and figuring out what we can do for you. But that should be your biggest thing, not what the doctor tells you, not what the surgeon tells you, but what's best for me? What's best for my health? And will it help me? That's what I try to tell people. It's like, is it going to help you? And I'll give you the straightforward about it too. I'm not going to sugarcoat it and be like, oh yeah, you're going to feel great. Like that one guy with the leg, it's not going to do that for you. So I think you probably need to look elsewhere. But in a lot of cases, as you've seen the list, it can help. So I think it's worth trying, especially if we can avoid surgery that could cause some kind of complication or is maybe only 50 or 60% successful. You might still have pain. So I think that's it. Thank you for coming. Again, here's the website. Our website here. Did I put RRG's website on there? Did you see it?
It's just rg.bio.
No, rrg.bio.com.
No, rg.bio.
rrg.bio. That's it. Okay, that's it. Again, these are some of the things I've been able to do since I got stem cells, which I didn't have a problem. This is a very famous waterfall in Hawaii. Not much of a hike, that one. You basically just drive up to it. This one was a big hike, and that's a waterfall in Yellowstone National Park, kind of off the beaten path. And of course, Kings Peak. Did this one that's my son there. Did this one just a couple years ago. So lots and lots of fun. Yeah. All right.
One last question.
Yeah.
For me anyway. I was curious about where these come from. I know we said the I've heard and read that when you do transplant, same heart transplant. It's almost like the heart has a memory of the person that received it, and sometimes that does change the person. Same thing with, blood, with different types of blood.
Right.
What about drug babies? That are, they're born with an addiction. I mean, how do we filter all that out? I mean. how
Have a
is-
great answer to that.
That's a good question.
Yeah.
Dave, maybe you might.
Well, so all the women with pre-screened before they have their birth, they're 18 to 24-year-old women.
So
C-section birth.
that's one of the
They're-
criteria,
Yeah, first birth, it's gotta be a healthy birth.
first one, I mean,
Yeah.
the first.
It's their first birth, gotta be a successful, healthy birth. We do the birth father, birth mother for 3 generations. Test for all the diseases, everything, HIV, hepatitis A, B, C, all the degenerative diseases, everything. No blacks, no vaping, no smoking, no tattoos, no drinking, on either side or in the household.
You get lies on that?
Lice?
Lies.
Lice. Oh, lice.
Sorry.
It is possible, then after we receive the vote before we send them, we then do several tests in addition, and then we process, we do additional tests to make sure it's correct. So, I guess there is a small possibility. We've been working with the OBGYNs for long enough now, 15 years. We have very good relationships with them. So they're screening them before we actually give them the application.
Did the mothers get paid?
They do not, it's a legal advice. So we do have to pay the doctor for their time, the medical facility staff. So it's not, unfortunately, they're not free, even though they could be. They're not actually.
For those of you online, Dave from RRG is answering some questions about the process of getting the tissue and whether there's any kind of traits from the tissue that could possibly lead to different traits in the donor, in the receiver. And so he's answered those questions about all the screening process. They're screened on each side, mother, father side, make sure there's no communicable diseases. They don't smoke, they don't drink, they don't do drugs, that kind of thing. And so they ensure that the stem cells are from healthy parents and that there's no type of deformity or lineage problems or drugs or anything like that.
And see, let me just mention, that's one of the issues we have in, we tested in Costa Rica and Panama. The first thing we asked was where they from, give us your donor profiles. They didn't know. They just went to the hospital and grabbed. So, and that's important for us, and for me personally, I want to know exactly where it's from. You know exactly where my beef's from, exactly what my steps are.
Yeah.
That's so that's just me personally. I add resources.
So again, Dave from RRG saying that we know exactly where these stem cells are coming from. They've done all the screening, pre-screening, and then testing again to make sure the stem cells are safe. Whereas in other parts of the world, in Costa Rica, Panama, they're not exactly sure where their stem cells are. And so that could be an issue in those places, but not here. Kind of. Also, the distinct nature of these young, immature stem cells from the placenta tissue from the umbilical cord is that they don't have any, they have not been directed to do anything yet. So they haven't taken on any traits. They don't have any surface antigens or anything like that to cause any kind of lasting effect on somebody who received those. Again, kind of like O-negative blood, where you could just kind of give it to anybody. And as long as it's been screened and it doesn't have, HIV or hepatitis B in the blood, you're going to be fine, kind of. So does that answer your question? Okay, perfect. Any other questions?
Awesome. Okay, thank you.
Another round. Thanks, guys. Been a little bit longer than I expected.
So in the sake of time, I wanted to go over really quick the VIP ambassador program that we're Sending out here, hopefully everybody see me down there online. Good deal. So what we're doing, the protocol that Steve has put together traditionally is $5,500. So that includes the stem cell, the consult with Steve. He sets up a specific program for each individual. And what we're looking for as a clinic here at Pure Life Medical are 5 people that are willing to film and track their progress and give their video testimonials. In exchange for that, we're going to offer a discount on Steve's exact protocol. So the first 5 that sign up that become our VIP ambassadors, we'll do their videos, we'll do the same consults, the red light, the sound wave, stem cell, PRP, ozone treatments, everything is exact same, and we'll give $1,000 off to those 5 people that sign up. So if you're online watching, reach out to Jeff or myself here at Pure Life Medical. And then, yeah, we take your deposit, we set up the consult with Steve, and then we hit the ground running from there. So again, just to end it, thank you everybody for coming. We appreciate you all for being here. Have a good night.
Thank you.